All right, good morning, everyone. I know a number of people are still logging on slowly this morning, but welcome back. We'll go ahead and get started to another week of our Cardio-ECHO clinic, weight management and behavior change, cases and discussions.
Thank you, Jesse. I suspect that some folks are on spring break this week, which is true for many folks, but we will get started, and we have a very interesting session, I hope, this morning, plus two great cases to discuss as well. This is just an overview of our structure, and these are our disclosure statements. So today's discussants are Chris Taylor and Karen Bailey. You can read Chris's disclosure here as well as my disclosure that deals with the Dannon Company. Another reminder to use person-centered language. I think we're getting pretty good at this right now. It's interesting that this series was intended, I think, initially to put forth an emphasis upon social justice, public policy, racial justice. So we actually redesigned our weight management series from a year and a half ago to emphasize these particular topics. And this is something I've become interested in the last 10, 15 years or so, and that's food justice, which we'll talk about has a very interesting definition. So next slide, Rick. So the learning objectives for this brief didactic session are to, first of all, to define food justice, describe the potential for food justice to influence how people eat, and an example of how the food justice movement has influenced in nutrition. And unfortunately, the examples are few and far between, but there are a few out there that we'll talk about briefly. So the first thing I always do when I talk about food justice is to put people through a thought exercise. And because this is Zoom, it won't be quite the same as if we were in a room together, where you can actually solicit feedback in a much more spontaneous way. So imagine that you are at a medical conference or health professionals conference, and that it's a buffet lunch. And at the end of the lunch, you see this. And one of these things, and I'm not sure what these are. I know some of them look pretty good, some not so much, but one of these things is your absolute favorite dessert in the world. But you know it's very high in calories and sugar. It's not especially healthy, and you're trying to watch what you eat. How many of us, under those circumstances, would have enough resistance to forego our favorite dessert? Well, my guess is not so many of us, right? Would say, it's one time, I'm traveling. What could it hurt? You know, I know I'm not supposed to be eating this stuff today, but, you know, I'm just going to have it anyway. And it's interesting that we expect our patients, who often live in a food toxic environment, to do the same thing all day long, everywhere they go. So, and that's very difficult because this is palatable food. It's things that bring us pleasure, things that the sensation you get from eating this sort of stuff is really something that is unparalleled. And if the alternative that is presented to you is celery sticks with vinaigrette or something like that at the end of the line, you're probably not going to choose it. Let's face it. Okay. I wouldn't choose. I would choose the dessert, assuming I was interested in one of these things. Now, I want you to consider a thought exercise. This particular dessert menu buffet, this is a true story, was prepared by a catering company. And the catering company that catered the desserts specifically was owned by this woman. So owner of a popular catering company sued after abusing and calling her loyal employees whores and dirty Mexicans. Okay. How many of you would still feel comfortable having that dessert? I'm guessing not too many folks, right? It would be an instant turnoff. The question is why? What is it that is triggered in that specific moment that causes you to think, wait a second, no way, I'm not going to pander to this? It is lots of things. Obviously, number one, this woman's attitude is inconsistent, I'm hoping, with our values. And secondly, that by patronizing her particular business, you are continuing to support someone who doesn't deserve our support. So there's a couple of ways of thinking about it. So it's suddenly the idea of social justice, racial justice enters into an equation where you didn't really think about it before. That's how I want you to think about food justice as we go forward. Now, this is 100% true story. This lady is in the New York area. There are multiple lawsuits, multiple. This is not a one-time thing. And of course, her business is pretty much done. So what is food justice? Well, first of all, it's important to remember that the whole idea of food justice emerged not from what we eat, but who works in the food industry and how it is grown. That's where the movement came, and it comes mostly from California. So it's pretty foreign to what we're talking about. We're talking about helping our patients to achieve a healthier weight. We live in an area where we don't have these giant agricultural farms. We have farms, of course, but not on the scale that they do there. And the treatment of farm workers is not a hot button issue here in Ohio. Nevertheless, let's talk about some of these definitions. So first of all, food justice seeks to ensure that the benefits and risks of where, what, and how food is grown, produced, transported, distributed, accessed, and eaten are shared fairly. Food justice represents a transformation of the current food system, eliminating disparities and inequities. So when they talk about eliminating disparities and inequities, they're not talking just about the eaten and the shared part and the access part. They're also talking about how it's grown as well. So, you know, I grew up in the 70s and 80s. I remember bananas where I grew up costing 39 cents a pound. How much do they cost now? 39 cents a pound. So something is wrong, right? With that, you know, you say, well, wait a second, that doesn't make a whole lot of sense that we are paying the same amount that we paid 45 years ago. But there's something that's inequitable about the system. Okay, so food justice, according to another definition, is communities exercising their right to grow, sell, and eat healthy food. Now, this is more of a there's a movie called Growing Cities that actually I was in the movie. It's about urban farming. So this is kind of hinting on that sort of thing. And I think that's important. It's interesting. Whether it really will solve many of our issues with our food supply, I'm very skeptical about. So healthy food is fresh, nutritious, affordable, culturally appropriate, grown locally with care for the well-being of the land workers and animals. People practicing food justice leads to a strong local food system, self-reliant communities, and a healthy environment. So these are all, I think, very noble goals. But for the patients we're going to discuss today, who are struggling with obesity and type 2 diabetes, accessing locally grown food that done with care of the land workers and animals is probably a little bit ambitious. But if you look at all the definitions that are out there, there are three pillars that emerge over and over again. Healthy food for all, which is the main one we're interested in, right? Sustainable food systems. And that means that growing food that does not disrupt our environment, our land, cause degradation of the environment over time. And of course, justice for food workers, which was the original intent of food justice. It was not, let's make sure everyone has healthy food. It was to make sure those people are treated fairly. In many cases, they are not. So let's go back a couple of sessions, and I talked about this. What determines what we eat? It's the taste, it's the taste, it's the taste. Number 1 to number 20, okay? That is what we eat. Followed by convenience and price, which are roughly equivalent. Sustainability is way down the list, especially for our patients who are often struggling to get by, who are not terribly concerned with whether or not what they eat is sustainable. They're looking for something that may be healthy or nutritious, that is relatively inexpensive and is accessible to them. So the sustainability, I think, is important, but it really is an upper middle class value. And if you ever go to Whole Foods in Cleveland or wherever else you happen to be in Columbus, et cetera, you'll find more people who are interested in this aspect of their food supply, but the prices are much higher as well. Where does social justice fit into it? I put you through that thought exercise on purpose, and I'm hoping there was a sudden stop and say, whoa, no, I'm not going to eat that. I don't care if it's my favorite dessert. I don't care how good it tastes. And even if I don't get a chance to eat this again, I'm not eating it. So could it be a driver of consumption? Well, we don't know. We know that some of these things are not taken into consideration as we design our systems and our policies and our priorities to encourage people to consume healthier food. Next slide. So what is the definition of insanity? Many of you have seen this quote. This is the actual quote, which is a little bit different. I was always taught Einstein said the definition of insanity is doing the same thing over and over again and expecting different results, but it's repeating the same mistakes over and over again and expecting different results. It's been about 25 years that we've established farmers markets, subsidizing food through SNAP benefits, trying to address food deserts, etc., public education, healthy plates, dietary approaches, etc., etc., etc. And what has happened to our rate of obesity over that time? It's only gotten worse. It's gotten much worse in poor communities over the last couple of years, and we talked about this last time, largely due to COVID as well. So we can keep doing the same thing. And the problem is that we won't really get anywhere. And one can say, well, how do you know food justice is going to be a useful strategy? Well, I don't know, but I know what we've tried already doesn't work, and we can keep doing it and spending a lot of time and effort doing so. Next slide. So the approaches that we have tried rely upon concepts that I won't say are wrong, but I think we ought to question. I would be able to achieve a healthier weight if only there were healthier food in my community. Okay, that's a big one. I would be able to achieve a healthier weight if only there was a recreational facility in my community. What do Jim and I hear? I would be able to achieve a healthier weight in our clinical environment if only my sister didn't bring over unhealthy food in the evening. If only if only that my work wasn't so stressful. There's all of these sorts of things that are cited as barriers, but this is one that is a community level one. There are problems with that, and I can't get into all the details of what goes on, why this is a problem, but in many cases, supermarkets have been brought to poor communities. Washington, D.C. is one example of that. The cities here in Ohio are also examples of that. How do you lure a supermarket to a food desert? Well, you give them a tax break. The tax break issue, I think, going back several years in Washington, is a big controversial one. So in Washington, D.C., very expensive place, much more expensive than any place in Ohio. A small supermarket would be appraised around $6 million. That's not like a big Giant Eagle or whatever you have in your area. It's a relatively small supermarket. The tax rate is $1.85 per square foot or something like that. So the amount of tax per year is $120,000 to $200,000 per year. They get a 10-year break, no property tax on it. $2 million gone. $2 million could do a lot of good for a lot of people in poor communities, I think. And so that's gone. And of course, maybe after the tax break is over, they might just close up shop. And there's no guarantee. Remember, we talked about this last time. You put the supermarket there, that it's going to improve eating habits in the community. In fact, what's been shown over and over again is people tend to buy the same things that they were buying before, except at a lower cost, and they are able to buy more of them. So what have you really accomplished besides cities are strapped all across the country, missing out on $2 million worth of revenue. So another approach is convenience stores, which already exist, right? Why don't convenience stores sell healthier food? Well, there's a whole book about this phenomenon. First of all, if you interview convenience store owners, and how they choose to purchase the foods and items that they sell. First of all, it's mostly what the demand is. And of course, you see cigarettes and alcohol and unhealthy snacks, and that's what the demand is. That's what they'll say. And they say, well, we'd be happy to sell healthy food. But when I talk to the supplier of apples or fresh fruit or pears or whatever, they want me to buy a huge box of it. And I know they're going to go bad before people buy them. So this is an interesting story. Nola Liu, who owns a small DC Central Kitchen, goes into a corner store in Northeast Washington, DC, not Northwest. Northwest is the really, really prosperous part. And was passing out a recipe for cinnamon pear crisps because the convenience store was selling pears for the first time. She thrust a card at a man in a blue knit hat who was on his way out. And he asked her, "Are you going to make it for me?" He asked. And then she said, "No, you have to make it yourself." And he said, "I'm not much of a baker," he said, and walked out, which I think is a pretty sincere sort of approach to it. So of course, there are challenges in bringing fresh fruits and vegetables to these communities. The idea that you can just provide healthy food and people will eat it is simply wrong. Now, people are very invested in these concepts, and sometimes they're sincere about it. Sometimes, I remember when I was in Pittsburgh, we brought a small grocery store with healthy food to a housing community, subsidized housing community, mostly for seniors. And after 3 months, it didn't do well. We didn't sell very many things there. It was subsidized by a community group there, and I helped set it up. This is back in the late 1990s. And there was a young man whom I really liked. He was really sincere about it. He had a lot of energy. I think he had dropped out of high school and we hired him to run the store. And he had limited hours, but he was running it. And every time you talk to him about shutting it down, he got very upset. And he goes, "You're taking away healthy food from these seniors, and including people like my grandparents who deserve to eat healthy food and stuff like that." And I said, "Yeah, but they're not buying it. They're not eating it." And finally he said, "Well, I'll be honest with you. This is a great job. It's an easy job. I get to interact with people, and that's really why I want the store to remain open." So sometimes I wonder if the other benefits of these supermarkets supersedes the idea that they're going to change eating habits. And there are benefits. Of course, there's employment that takes place. There's a physical presence. There's pride in the community, etc. But in terms of healthy eating, not so much. So another barrier, we talk about healthy food is so expensive. No, it's not. It says that a healthy diet, now that's a really healthy diet versus an unhealthy diet, costs about $1.50 more per day. A lot of unhealthy diets are significantly more expensive, especially if you rely on fast food, which for a family of 4 is $22 to $30 minimum at McDonald's or Burger King per day. So it's a significant amount of money. So this is just kind of home cooking, comparing healthy food to unhealthy food. So I think we ought to challenge some of these notions. And the reason we ought to challenge them is if we keep investing in this, we will never get anywhere. If we keep saying, well, healthy food's too expensive, well, then what do? Do we bring down the price of healthy food? We can try to do that, but the longer we invest in these, the less likely we are to get to the root of the problem. I simply don't have time to cook and have to deal with a lot of stress. Okay, so who has time to cook is a USDA report. Guess what? Just about everybody. Just about everybody, including over the last 2 years, men are cooking twice as much, I can speak from firsthand experience, as they were prior to the pandemic. And upper middle class men are cooking almost as much as upper middle class women. Here's another one. There are no significant racial or ethnic differences among major groups in the United States in the amount of time or effort spent cooking. It's 37 minutes a day on average across the board. Slight differences. Older women tend to spend more time cooking than other groups, but it's not hours and hours as it was, a couple of generations ago. It is become very, very common, and many people are doing it. Let's keep that in mind as we go forward. So I'm not saying that all of those very, very entrenched concepts are wrong. Food deserts, healthy food being more expensive, not having time, being too stressed to cook, etc. I think those are probably true for some people. But let's talk about food justice, which really, really kind of gets me angry sometimes, but I started to notice this a long time ago. As some of you know, I wrote a popular book for parents when I was in the childhood obesity field back in 2004, 2005 is when it came out. And it came out around the same time as a book called Fast Food Nation. It was a couple of years after that. And there is a little bit about this phenomenon, but then you start to look a little bit at what actually is going on. This is the change in total food-related ad spending spent on Black targeted TV which are television programs that target African Americans specifically. And you'll notice that a lot of the unhealthy junk food, fast food, there's a tremendous increase, and it continues to increase today. So those companies are shifting their advertising focus to a specific market. Junk food ads overwhelmingly target Black and Hispanic kids. Huge difference, huge difference. And now you'll see a decrease. For example, in 2013, you're looking at Black children ages 2 to 11, 5,225 ads per year. It's gone down. It's gone down because kids are watching less TV and playing on their devices. That goes across all, of course, ethnic, racial, age categories. People are just watching less TV, but they're still getting the ads, right? But it's double. It's double the amount that other children are getting. It's a huge, huge difference. And the ads are designed. It's not just that they're being shown to them. They are designed to appeal to these minority groups. You know, I said this in the other ECHO program at the University of Chicago. If you walk into a Mexican grocery in Chicago, the number of soft drink varieties is astounding. Many of them are imported. And then you see the same things advertised on Spanish language TV across the board. It's a huge difference, and it's deliberate. Next slide. So fast food has become, this is a book by Marcia Chatelain, which is actually very interesting. I have not read it, but it's called How Fast Food Became Black. And it talks about McDonald's and targeting African Americans. If you look at ads in the 70s, they often feature African American families, which I've shown you before. But also the owners, the franchise owners, are disproportionately African American. The communities, the workers, of course, are. So it's become a major cultural phenomenon. And I will remind people that in no culture in the United States or anywhere is McDonald's a traditional part of the diet in any group. Next slide. So let's rethink this. Now, there's a lot more evidence that I can provide to you of how unhealthy food has deliberately targeted communities of color, poor communities, rural communities, people who are prone to obesity and type 2 diabetes for various reasons across many different cultural groups in the United States. There's no question about that. And the more I show you, hopefully the more you'll realize that it's a reason to get passionate and a reason to get angry and a reason to be activated to do something. So let's rethink this. And let's not abandon the traditional concepts of access, price, food deserts. Perhaps those are important. But if the definition of insanity is doing the same thing over and over again, and we've been doing this for 25 years with no progress, maybe we ought to try something new. So there are several books on food justice. They are all over the map. I just read one from two leading experts. 90% of it is focused upon how food is grown and justice and safety, occupational safety for food service workers, which are extremely important issues. But we're not discussing those in this particular series. So if we rethink food justice, we can think about it. First of all, the concept of empowerment. That means empowering individuals in ways that we have not before, okay? When you say, I could only achieve a healthy weight if there was a supermarket in my community, or if I had time, or if I had, if my treadmill was not broken. Jim and I have heard about many treadmills that are broken and apparently take months and months to fix. That's one thing. That's not empowerment. Empowerment is the exact opposite. I am going to decide what I eat, when I eat, what kinds of physical activity I do, because I'm in charge. And that's a whole other way of looking at it. So first of all, this is the READ acronym. Recognition that food that is highly processed and high in sugar, calories has been deliberately marketed to populations which suffer disproportionately from obesity and its consequences. Just recognition, just putting that information out there for our patients. Number two, empowering consumers to make choices not only based on the primary drivers of taste, convenience, price, and sustainability, but also on the basis of fair and just marketing practices. Okay, we'll see how these might work in action in a moment. Number three is the A, advocating for healthier food from existing sources. You don't want to be spending millions of dollars on hard-earned tax revenue to bring a supermarket to a poor community that may or may not have an impact. Let's try to work with what is already there, whether it's a cart, whether it's a stand, maybe it's a farmer's market or something, or if it's a convenience store, and see if we can actually provide some healthier food and just experiment with it, see if they actually sell. And number 4 is the most important thing, declining food that just isn't aligned with one's values, which I think we went through with the thought exercise. I'm not going to eat it because I don't believe in it. I just don't believe in the concepts that underlie it. So let's see how this might work. Next slide. So recognition is learning and thinking about unjust marketing practices, not just presenting giving a long presentation about how food companies have unfairly targeted specific communities, just like cigarette companies, just like alcohol, all sorts of things, but food in particular, but get people to contemplate it and say, well, what do you think about that? Empowerment, asking questions about why and how specific foods are marketed to specific communities. Why are you trying to sell this particular type of soda in my community? That's a question that we ought to be asking. Advocate, does your snack need to be so high in sugar? My family would like to reduce its consumption of refined sugars. So it's an advocacy approach to it. Why do you have to make this so unhealthy? Can't you improve it? And of course, that will hopefully stimulate some change. And declining, no thank you. Not only, this is an example, not only is this a poor beverage choice, but I don't like the way the company targets children or families in my community. Okay, so these are some of the strategy. Of course, we can go into a lot more detail about how these might take place. We're healthcare professionals. Food justice isn't something that we ought to be targeted for. It's something our patients ought to receive. And I think that when you talk about food justice with your patients, it's got to be a pretty brief sort of thing. And this is an emerging concept. It is largely overwhelmed, I think, by especially now, given the increase in wages and restaurant workers and food safety and all those things. 90% of it is about that. But for us who are involved in trying to get our patients to achieve a healthier weight, to prevent complications of obesity, there are things that we can tell our patients. But at this point, I think the most important thing is just to tell them what the concept is and to get them a little bit activated, a little bit energized about making healthier choices. So thank you very much. We'll take some questions if we have time.
Just really quickly, I know we're at 9 o'clock. You should just have your post-clinic survey in your inbox. That's our usual survey to be completed by tomorrow at 5. And other than that, I'll let everybody go. Hope everyone has a great rest of their week.
Okay, thank you, Jesse. Thanks, everyone. Great session today. See you next week. Bye-bye.